Miss Khadija came to us in the month of October, all the way from Kenya, for the management of her bronchial asthma. She'd been suffering with bronchial asthma for a long time, had been on regular medication, was despite that requiring to take steroids orally, intermittently, and for prolonged periods.
I've been in and out of hospital for some time, but this year, since the beginning of this year, the situation was like it was not getting out of hands. Like for the past 3 months before I came here, I have had about 5 admissions.
But despite that, her asthma was not coming under control. Her day-to-day activity was majorly restricted. She could only walk a few steps without getting breathless. She was continuing to require high dosages of inhalers, high dosages of steroids.
And they told me that my asthma is past stage 4 and it has already gotten out of hands and there was nothing they could do about it.
That is the state she had come to us with. We evaluated her thoroughly. We got her CT scans done. We repeated her allergy test. We also did a sleep study for her. We found she had an obstructive sleep apnea, corrected that. Despite that, her breathlessness was persisting. That is when we considered her for a procedure, bronchial thermoplasty, which is done in 3 sessions. The 3 sessions are 3 weeks apart. In the first session, we tackled her right lower lobe. In the second session, which was done 3 weeks later, we tackled her left lower lobe. And in the final session, which was another 3 weeks later, we tackled her both right and left upper lobes. Following which, she now has feels a dramatic improvement. Her breathlessness has gone down significantly. We're now reducing her dosage of steroids also, and I'm quite hopeful that she'll remain well in future as well. She's now traveling back to her country, and I'm sure she'll remain well there.
Dr. Vivek Nanki has already advised we'll be having video conferencing with my physician and him from where we are. I'm very grateful actually for the services that I've received here, especially the healthcare workers. Their services were commendable. The support staff also, they are doing their work. All in all, I give thanks to Dr. Nangi because he really took me from far. Wherever I was and where I am right now, thanks to God.
I would only like to say that patients who've had a chronic bronchial asthma, long-standing, persistent, who despite therapy are not improving, especially if they've received their biologics also, or if they are unfit to receive biologics, we now have this new modality of treatment available. Bronchial thermoplasty is a revolutionary therapy that is now available to us.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.